I'm Mike Anestis. I'm the executive director of the GVRC and an associate professor in the School of Public Health here at Rutgers. Today, I'm going to talk to you guys about an aspect of sort of the gun violence phenomenon that touches on all areas of gun violence. I myself am a suicide researcher, and so a lot of my talk is going to be framed within that context. But I'll circle back at the end to make sure we emphasize that the point, the main sort of focus of this talk, a surge nationally in firearm purchases, again, is relevant across the spectrum of gun violence outcomes. Before I get going, I do have to have a sort of quick disclaimer. Some of the work I'm going to be talking about was funded by the Military Suicide Research Consortium, which itself is funded by the Department of Defense. And so any opinions I express are mine, not necessarily those of MSRC or the DoD. So as I said at the beginning, firearm purchasing patterns, meaning how many firearms are being purchased, who's doing that purchasing, where are these purchases taking place, what are the reasons for those purchases, those ideas are relevant to all forms of gun violence, whether we're talking homicide, suicide, unintentional shootings. In this presentation, I'm going to center the conversation around suicide prevention because quite frankly, in 30 minutes, I don't think I could get all of gun violence into here, but I just don't want to create the impression that this is somehow only relevant to one outcome. This is just one way of explaining sort of the importance of an ongoing phenomenon. And so let's start with a sort of quick conversation, the scope of the problem. And when I say the problem, I'm referring to firearm suicide, just to make sure that we're sort of on the same page with some basic facts. And Dr. Betts' talk earlier, I think, provided us with a good bit of basic understanding of what's going on here. So some of this is a repetition, but again, I want to get everybody sort of in the same frame of mind about what I'm talking about and why I'm talking about it. And so one of the points I want to raise is just how big of an issue this is. So we talk about suicide being a low base rate phenomenon. It means that, in any given moment, there aren't that many people who are at risk of dying at this particular moment. But if you zoom out and look at the raw numbers, the number of people who die by suicide in our country every given year, you realize, wow, that's a lot of folks. And then when you think about how many people consider themselves lost survivors, and there's research by a great scientist named Julie Searle showing that there's somewhere around 150 people who consider themselves a lost survivor for each of these deaths. My goodness, the scope is huge, right? And so in 2020, the year we have the most recent official CDC data on deaths, there were just under 46,000 folks in the United States who died by death by suicide. In any given year, outside of sort of COVID time, suicide lands as the 10th leading cause of death in the United States. It's bumped out of the top 10 with COVID arriving, but still obviously a big deal. And what's most relevant to today's general topic, to the GVRC, and to the work that I do, is that more than half of those deaths are by a single method, which is firearms or self-inflicted gunshot wounds. So in 2020, it was on the high end, 53% of those deaths. So 24,292 out of the 45,979 suicide deaths were self-inflicted gunshot wounds. That's enough to make firearm suicide a top 15 cause of death on its own. And it's more firearm suicides than there are homicides by all methods combined, right? This is a big deal. How common this is way exceeds the frequency with which we talk about it. And what's startling about this is that firearms are actually used in less than 5% of all suicide attempts in the United States. So if someone attempts suicide in the US, they almost never use a firearm. And yet, if someone dies by suicide in the United States, more often than not, that's the method they used. That tells you not that the method's the only thing that matters. It isn't, but it tells you it definitely matters. So a few more sort of basic facts to keep us all sort of on the same page. We know that suicide is 3 to 5 times more common in homes with firearms present compared to homes without firearms, and that risk extends to everybody in the home, not just the person who considers him or herself the primary owner. We know that in the year following the purchase of a handgun, risk for suicide goes up dramatically for that year, but actually the median number of years, so around the middle, that went for how long someone's owned a firearm before they use it in suicide death is 11 years. So the most common story is that someone has had a firearm for a decade or more before they use it in their own death. We know that risk increases dramatically even further if the firearm's stored in safely. And it's sort of pausing there for a second to clarify what I mean. So from a suicide prevention perspective, when I talk about safe or secure storage, I mean stored unloaded, separately from ammunition, in a locked location like a gun safe or a lockbox, and ideally with some sort of locking device in place, maybe a cable lock or a trigger lock. We also know that a lot of the most common reason folks own firearms is for protection. And so if someone owns a firearm to keep themselves safe in their home because they're afraid someone's going to break in the middle of the night and shoot them, their definition of safe storage might be different than mine. It might be that, yeah, I have one on the ready. It's loaded and on my bedside table in case someone comes in. So Dr. Betts mentioned this, but being careful with language, what we mean, making sure that the words that we're saying mean the same thing to the person who hears them. And in this case, they often don't. So safe storage to me is unloaded, separate from ammo, in a locked location. And then one more sort of foundational fact that's worth noting is that, and this came up earlier, but 85 to 95% of all firearm suicide attempts are lethal. So folks die 85 to 95% of the time, whereas the most common suicide attempt method in the United States, intentional overdose, results in death 2 to 3% of the time. So if someone attempts using intentional overdose, they almost always survive. If someone attempts using a firearm, they almost never survive. And why does that matter? Well, there was a study in 2002, I believe, that showed that 70% of folks who survive a suicide attempt never attempt again. And that tells you, wow, second chances really matter a ton. Um, but firearm suicide attempts rarely provide someone that opportunity for a second chance. And so the take home message is that when you prevent someone from attempting suicide using a specific method in a specific moment, there's a really profound chance you prevent them from ever attempting suicide at any point with any method. Not because the method's the only thing that matters, but because the uniquely high case fatality rate of firearms changes the story and it doesn't give people a chance to be a survivor. It's also worth noting that not all groups are impacted by firearm suicide equally. So I mentioned just over half of the suicide deaths in this country nationally result from this single method. But if we zero in on service members, United States military service members, it's around 2 out of every 3 deaths are by this single method. So again, the method isn't the only thing that matters, but the method really matters. And so let me give you a couple of really quick anecdotes that really drive this point home, and 2 of them are completely unrelated to firearms, but they show the point that means safety or efforts to take a specific method for suicide and either making it less deadly or less available can dramatically and profoundly um, and reduce the suicide rate and maintain that reduction over time. And so the first example on the top left is Sylvia Plath, who died in the UK by suicide by sticking her head in the oven. And a lot of people are sort of astounded by that. And it wasn't because she burned herself to death, it's because there was carbon monoxide that in domestic gas in the UK that was at such a high level that folks would quickly suffocate. And so this was the number one suicide death method in the mid 20th century in the UK. And the UK detoxified domestic gas. And in doing so, they reduced the death by suicide by that method by 90%. But what's most important is that suicide rates by other methods stayed the same. People didn't just find another method. And so the overall suicide rate in the UK went down 30 to 40%, stayed down. In the bottom right, more recently, you see a farmer in Sri Lanka. Sri Lanka was having a hard time with suicide deaths by pesticide. In that scenario, what they did was they banned the most lethal brands of pesticide, and the overall suicide rate in Sri Lanka went down by 50%. The example in the middle is the one most relevant to this conversation, though. And so this is a soldier in the Israeli Defense Force where there's compulsory military service amongst young citizens. And what they were finding was a very high suicide rate amongst young service members who were taking their service weapon home on the weekends or on holidays and dying by suicide using that firearm. And they just changed the policies. Said, look, when you leave for holiday or for weekend, you check your service weapon into the armory. And private firearm ownership is extremely low in Israel. And so there was no access to this method. And the suicide rate amongst those service members went down by 40%. They weren't dying by other methods. They weren't dying on other days. They just were dying a lot less frequently because the most lethal and commonly used method became harder to access in those difficult moments. Couple other quick points, and then I want to pivot to the main focus of today, which is the firearm purchasing surge. So there's a study put out by a friend of mine, Craig Bryan, and several colleagues that to me was really troubling, but it captures a really important pattern. And he was looking at service members and veterans who were in primary care. And what he found is that suicidal service members were less likely to have a firearm at home. That's good. But What he also found is that suicidal service members who did have a firearm at home were far more likely to store them unsafely, in this case, loaded and in a non-secure, unlocked location. That's bad. Um, but when you find something sort of scary and bad like that, you think, well, maybe that's a one-off finding. It's not really indicative of a pattern overall. But unfortunately, it does seem to be. And we replicated that exact same finding in the National Guard. So the folks with greatest risk, people who are suicidal and have a firearm at home, are the ones most likely to store that firearm unsafely, meaning they have ready, easy access to it in a difficult moment. That's a problem for a whole host of reasons that I could spend hours talking about, and maybe we'll circle back to in Q&A. But I'm skipping by things a little bit quickly to get to the main focus, which is this: the firearm purchasing surge. So prior to 2020, when this surge began, there were already more firearms in the United States than people in the United States. So we're talking hundreds of millions of firearms sort of in circulation across private homes. That's a lot. That is unlike any other nation in the world. But what's interesting is that in 2020, the rate at which firearms are being purchased skyrocketed, which raises a lot of questions. Well, who are these folks who are purchasing firearms? And there are a couple of studies that came out recently that I think help us to see some important patterns emerging from the early data on who's purchasing firearms and causing this rate to go up so high. And so results from the 2021 National Firearms Survey were published by Matt Miller, Deb Azriel, and their colleagues. And in this case, they had over 19,000 folks, about 1 in 3 of whom endorsed firearm ownership. And what they found is that about 3% of US adults, they estimated around 7.5 million folks, became new firearm owners between January 2019 and April 2021. Now, some of that data predates the surge. The surge really sort of kicked into gear in 2020, but still, that's a very large number of folks who have become first-time firearm owners during that time period. But what to me is most interesting is that of the new firearm owners, 50% identified as female, 20% identified as Black, and 20% identified as Hispanic. And these numbers are fundamentally different than what you have typically seen in studies looking at firearm ownership rates. And so that tells us that there are some important demographic shifts happening. And we'll come back to this more. And in fact, Dr. Liddell Quinton will also touch specifically on surge firearm purchasing amongst Black Americans in a presentation after lunch. And so I'd encourage you to listen in on what she says about this. A second study published by Casker Fossey and some of her colleagues used a different data set, and they estimated that 6% of US adults purchased a firearm between March and mid-July of 2020. And about 1 in 3 of those folks were new firearm owners. So they'd never owned a firearm before, but between March and mid-July of 2020, they decided to purchase one for the first time. And so that equates to about 6.5 million folks becoming first-time firearm owners in less than half of a year. That is a really massive shift, again, in the circulation of privately owned firearms. And that, again, has implications for all sorts of things, risk for all sorts of gun violence outcomes. So what are the take-home points from those couple of studies? Well, first, the demographics of firearm ownership are changing. And second, people are purchasing firearms at an unprecedented rate. But let's try and put a little bit more of a sort of empirical description of what exactly has gone on. And it's important to know that, look, we don't know exactly how many people purchase firearms or who owns firearms. We don't have some sort of national registry. And this talk is certainly not me advocating for us to have one. But we have all sorts of ways we estimate firearm ownership. And so researchers have done that. And some of the numbers that have come out involve, usually typically using National Instant Criminal background check data, that there was about a 40 to 60% increase in 2020 relative to 2019 in how many firearms were purchased. Again, that's an astoundingly large jump. They were talking of millions of excess firearms beyond what would have been expected are then in circulation in private homes across the country. Here in Jersey, the state police released numbers saying that there was a 332% increase in permit requests in 2020 relative to 2019. So this isn't a phenomenon that's restricted to high gun ownership red states. This is a phenomenon that extends across the political spectrum and all the way down to states like New Jersey, which has one of the lowest firearm ownership rates in the country. So this is a universal. And we know very little about who is purchasing these firearms and why. And if these folks are different, that's really important for us to know because it impacts what we know about the research. And so it is worth it also just pointing out that, yeah, I'm talking about this one purchasing surge, and this was not expected necessarily, but purchasing surges happen, and they happen to in a somewhat predictable pattern. So some of the places you see firearm surge purchasing happening is leading up to elections where it seems like Democrats might take control. Also, following mass shootings, you often see purchasing surges, in theory, because folks are anticipating legislation being enacted afterwards. So the idea is you need to purchase now. So let's talk a little bit. And so I don't have one specific GVRC study I'm going to talk about. Instead, what I've done is I put together a series of infographics we've made of studies we've published on this topic over the last year or so to try and get some general take-home points. There's no way for you to get all the information off of these infographics in the talk, but these are all freely available either off our Twitter feed, which is at NJGVRC, or on the GVRC's website. We have a whole tab where you can get all of our graphics. They're free. You're welcome to share. The idea, again, is to get data out from the ivory tower and freely available for use. The main take-home point from the slide you see right now, though, is that, and this was in the case of folks who around June, July 2020, so at the peak of the purchasing surge, we asked a group of 3,500 folks, hey, are you thinking about purchasing firearms? And of the folks who were intending over the next 12 months to purchase a firearm, what we saw was a lot of increases in anxiety and stress. Some of it was contextually specific. I'm stressed about COVID, but a lot of it, and we're seeing this across multiple studies, was actually more about what we call threat sensitivity. The world is dangerous, and I don't know that I can trust people, or intolerance of uncertainty. I'm not comfortable when I don't have a sense of what's coming next. And so you think about the context of the last couple of years, what we've all lived through. There's a lot of uncertainty and there's a lot of stress. And so that might prompt someone who's not necessarily comfortable with those feelings to say, I want to have a sense of control and mastery over that. And a firearm might give them that sense of control. Sort of relatedly, most recently in a paper led by our colleague Dr. Joy Anestis, and also featuring a GVRC doctoral student, Taylor Rodriguez, we looked again in that same data set of 3,500 folks demographically matched to US Census demographics. And we looked at folks who had purchased between March and June or July of 2020. And what we found is the folks who had purchased firearms during this surge had greater levels of disinhibition. So a tendency when they are feeling stronger emotions to have a little bit less of a brake pedal on their behavior. So more likely to act impulsively or differently when upset than they normally do. Folks also had higher levels of threat sensitivity, meaning that when I feel threat and fear, that's more aversive to me. And so what you have is folks who are purchasing firearms during the surge being less comfortable with that sense of stress and more inclined to act quickly when feeling distressed. And so one of the results of that combination of factors might be, am going to purchase something that gives me a sense that I am feeling comfortable, that I am feeling safe. So one of the studies we actually have under review right now, and co-author includes Dr. Betts from earlier, we decided to try again to better understand different ways to understand, well, who are the folks who are purchasing firearms? And then there are differences. So there are different communities of folks purchasing for different reasons. And so we used a sample of about 6,500 folks, again, matched to census demographics and drawn from 3 states, Jersey, Minnesota, and Mississippi. And we used something called latent class analysis. It says basically, look, here's a bunch of variables. In this case, sort of political leanings and voting behavior and sort of health behaviors, mask wearing, COVID vaccine intent. And these data were from early 2021, so before vaccines were widely available. And we want to say, well, can we kind of sort people into groups based on where they are on these variables? And it turns out we could pretty well. There are folks who had pretty liberal beliefs and engaged in a lot of these sort of health behaviors, folks with moderate beliefs engaged in a lot of these health behaviors, folks with predominantly conservative beliefs who didn't engage in a lot of these health behaviors, and folks with conservative beliefs who do typically engage in a lot of these behaviors. And so you can see in this table how that sort of breaks down. You have that first group, they're very high intent to get COVID vaccines. They get their flu vaccine every year, and you can see their sort of voting patterns and political beliefs. And you can see all these things kind of changing across these 3 groups, where you have dramatically different levels of COVID vaccine intent in early 2021, and how frequently you get a flu shot, and whether you were wearing masks recently. And what all these things speak to is sort of how you perceive and respond to risk and how you might try to make yourself feel safer. And what we found when we looked at surge purchasing is that the group that was most commonly identified as I purchased a firearm during the surge were the folks who identified conservative socio-political beliefs and not a whole lot of those health behaviors. So not a lot of vaccine intent or flu shots or mask wearing. Um, but what was different is that among the people who purchased during the surge, the people who were new firearm owners, they were more likely to be liberal political beliefs with a lot of those health behaviors or conservative beliefs and a lot of those health behaviors. Something about those last couple of years just kind of changed how they felt and made them more likely to purchase a firearm. Why does that matter? Well, I'm actually going to skip ahead because I know I'm a little bit low on time here and talk about our most recent study on this published in JAMA Network Open. And what we found is for the second time, people who purchased firearms during the purchasing surge were more likely than other firearm owners and non-firearm owners to have had thoughts of suicide. That's dangerous, right? But most relevant to the last thing I just said, amongst people who purchased during this surge, the first time firearm owners, the people who became a firearm owner for the first time during this surge, were more likely than other people who purchased firearms during that time to endorse lifetime, past year, or past month suicidal thoughts. And that to me, as a suicide prevention focused person, is scary because that means the folks who are gaining their access to firearms are also the most likely to have endorsed a propensity to think about suicide. So I'm going to jump ahead because I want to leave some time for Q&A. And so I want to take a moment and just talk about a solution for this, right? So if all these excess firearms are coming in, and a lot of them are folks who are sort of firearm naive, they don't have a lot of experience with firearms, not a lot of training in firearms. One of my concerns is that maybe those folks aren't storing those firearms very safely. And safe storage, as I mentioned earlier, what it is, it's really important because it can help prevent not only suicide, but unintentional shooting. So, a kid finds the firearm and unintentionally shoots themselves or someone else, or fatal domestic violence, or theft and subsequent trafficking of firearms for use in crimes. So we need to better understand who are these folks purchasing now? How can we reach them and help ensure that when that firearm is in the home, they're mitigating the risk associated with that firearm being there, storing it in a way where all of these outcomes in yellow at the bottom are least likely to come into play. And so the last slide I want to leave you with is our New Jersey firearm storage map. It's a tool we created following in the steps of Dr. Betts and others to have a list of places for folks can legally temporarily store firearms outside of the home. Man, do we want to get more representation on this site, more participation, more geographic distribution. If you use the QR code on the right, it takes you right to the map. If you or someone else might want to be a participating site, man, reach out to us. And if you think you know someone in distress who owns a firearm, please share the map with them. It is free. No one's making money off this. The idea is simply to create an easier path for safe storage to be an option in a difficult time. So I'm going to leave it there because I know I've only got a few minutes. I'd love to be able to answer some questions. So my email is there. My Twitter handle is there, as is the GVRC's Twitter handle. So at this point, I'm going to pause. And if folks want to put up questions, I'm happy to take them. And the first one from Karen Cantor is, has there been a subsequent increase of firearm suicide among females? It's a little bit hard to track. The biggest increase I've seen in firearm suicides over the last couple of years is amongst Black men, actually, particularly young Black men. Have there been increases amongst females? Yes, and I have those specific numbers. And honestly, I was looking at them recently, and I can't pull them off the top of my head. You can see really high increases in percentage. It's important to remember that the raw numbers are a lot lower, though, so it's easy for a percentage to jump dramatically and have that not represent as many increases in actual deaths. But yes, and there is data out there showing that when the firearm is in the home, the risk again extends to everybody in that home. And so the suicide risk for a woman who's in the home, whether she's the primary owner or her partner is the primary owner, the risk is there. Second question from Robert, is there any data on time after purchasing a firearm in a suicide attempt? So yes, and the best data comes out of California. I alluded to this earlier, but I kind of sped past it. What the data shows is in the year immediately following purchase, in this case specifically the handgun, the risk goes up dramatically. But peak risk, the most common outcome, is 10, 11, 12 years down the road. So it's you're looking at sort of almost a bimodal thing, right? So right after someone purchases, and it's important. The idea isn't that they purchased and that made them suicidal. It's that sometimes suicidal folks purchase a firearm with the intent to use it in a suicide attempt. But that the most common story is someone has had bought a firearm when they weren't at risk. They didn't become at risk for years after the fact. And then that risk surged later on, years down the road, and that firearm that's been in the home became the method by which they died. I think I've got a couple more minutes, so let me take more. So, can gun purchase waiting periods affect firearm suicides? So, yes, and the Rand Corporation does a lot of really, there's a lot of research on um, legislation and how it impacts all sorts of outcomes, and the quality of that research varies dramatically. And the Rand Corporation recently put out a report that does a really good job of summarizing not just what the research says, but the quality of what different research says. And waiting periods is one of the forms of legislation Rand listed as having some of the best support, along with child access protection laws and licensing laws. And then, sorry, the slide thing's over it. So, given durability of firearms that some studies have shown straw purchasing entry into black markets may occur while after initial phase. Sorry, I just can't read under the slide thing. Maybe I can close. There we go. Do you have thoughts, studies on prospective longitudinal impact of firearm ownership surge and community violence exposures? I have thoughts. I don't have data, right? So it's a really great question. I don't like to sound alarmist. I don't think that we are doomed to a surge down the road in firearm suicides. I think that's not a good thing to propose that we are. But the reality is the environmental risk has shifted, and it's shifted long term because these firearms are in the home, and a lot of them are in homes that didn't have them before. So it's not just one more firearm in line. So what I think is that, yeah, we've got a long term issue. And that's why I lean so hard into going upstream, not waiting for suicide risk to emerge and saying, okay, how can we reach firearm owners and work with them to help lower risk, to keep people safe? Folks have made a decision to purchase a firearm and own it, and that's their right, and that's fine. I'm not here to argue with them about that at all. I'm simply saying that decision came with some risk, and that risk is probably going to be there longitudinally now because these firearms are going to be there. So, what can we do to help the idea of things like secure storage or storage away from home resonate within those communities? And how can we make sure that there are effective, easy, widely available tools for them to engage in those types of life saving behaviors?